let me start with a story about how the healthcare world, might work, say, some short time in the future. And I'm going to talk about a couple, Harvey and Louisa. They're sort of roughly the age of the people in this room. They have healthcare coverage. Harvey's working for a large employer. And what happens is his employer says you could stay with your existing plan, or you could opt in to this universal coverage pool that's available. And what we'll do is we'll take the contribution that we would normally make to your insurance plan, the age, sex adjusted piece of that, because Harvey's a little on the older side, so he gets a little more than average. A young fellow working in the firm would only get a smaller amount going into this universal coverage pool. Because the federal government has said we want to make sure that everybody has coverage for the important things, hospitalization and chronic illness. And so everybody has to be a member of the UCP. That's the universal coverage pool. So Harvey's employer put some money in. Harvey's got a wife, Louisa. She's got small business of her own. She never had health insurance for her company or her employees, but she now has the option to put in an amount for herself and her employees if she wants to. That wouldn't be nearly enough to buy a whole health insurance package. That's why she never bought it for herself and her employees before. But now she could put in a small amount. And it's all tax advantaged, just like those people who are working for the big firms. And it goes into the same pot. If they had 2 jobs, other employers could put in, because it's all fractional. You're putting money into a pot here. So they're putting money in, and they're sort of upper middle class. They don't need any subsidies for things, other than, of course, the fact that they're not paying taxes on it. But that's the way the world is right now. So what does this universal coverage pool do? Because it covers chronic illness and it covers hospitalization. So for hospitalization, it says we'll pay, the UCP, will pay new care delivery teams, what I'm calling CDTs, which are new organizations, physicians coming together with a hospital in which they may work. And these are the physicians who really spend most of their time in the hospital. They're the surgeons, the anesthesiologists, of course, the radiologists, the people who are doing the work that you never see because they're behind the white mask. And the check is a bundled amount. It's an amount that covers the hospital cost, the physician cost, a little bit of pre-admission workup. You need some imaging done, you need some lab tests done before your admission. That's bundled into it, as well as appropriate amount of post-discharge care. And of course, if you end up having a complication, that's part of that thing, because we don't want to pay them a second time for fixing the mistakes they made the first time. So there are some incentives in this arrangement if you think about it. The incentive is to figure out how to do it better, because there's a fixed amount of money. And so what we have there is an arrangement where the care delivery team could think about how to become more efficient. It could say to the anesthesiologist, you know, we have all this extra operating room time on weekends. How about we pay you a little higher rate out of the CDT amount so we can use that excess OR time. Spread things out. Let's be creative here. And they can be as creative as they want. The amount that they'd get would be based on the resources that are being used by those care delivery teams that provide superior care. I am not designing a program that's intended to be on the cheap. I'm saying we ought to have a compact with Americans to pay for superior care, above average care, not just average. Now, the care delivery teams, I think, will start asking, who are the guys who are in the high end of the good outcomes? Let's ask them what they're doing. This is like all the medical groups that are sending teams to Virginia Mason Clinic or the Mayo Clinic and say, hey, how are you guys doing it so well? And they say, come talk to us. We're not worried about the competition because we know we'll always be 5 years ahead of you. And we're professionals. We're happy to share. So that's the inpatient side. Now, what about most of the visits or interactions that Harvey and Louisa have with the medical care system? That's on the outpatient side. How do they do that?